Hello everyone, my name is Christopher Black and welcome to this Q&A session live from WHO headquarters here in Geneva, Switzerland. I'm so happy to be joined today by one of our experts here, Dr. Sylvie Briand. Welcome Sylvie, bienvenue. I'm wondering if you could tell our audience a little bit about yourself. What do you do here at WHO?
Okay, so I'm Dr. Sylvie Briand. I work at WHO on epidemic and pandemic diseases. Currently I'm very busy with the COVID-19 disease, but in the past I also used to work on the influenza pandemic, in particular in 2009-2010.
Excellent, and that's exactly what we're going to be talking about today, because we've seen a lot of questions in social media, people coming to our websites, questions coming up from journalists and press conferences, asking about the similarities between this new coronavirus, COVID-19, and flu. And so we thought it would be a great time to talk a little bit about the similarities and the differences in these two diseases. And so thank you for joining. We're going to unpack these two issues. In the meantime, if you want to ask a question to Sylvie, Dr. Briand, just put a question in the comment section of whatever platform you're watching us on, and tell us where you're coming from, tell us your name, and tell us what's on your mind. So thank you for joining. So, Dr. Briand, when we talk about flu, we're really meaning most times seasonal influenza. Can you tell our viewers, what is seasonal influenza?
Well, first, influenza is due to a virus, actually a family of viruses, and those viruses tend to circulate in human population of temperate climates. So that's why we see often epidemic of influenza during the winter season or cold season, depending where you live. And it's a respiratory disease, so it gives you cough, runny nose, fever, muscle ache, and symptoms that are common to most of respiratory disease, basically.
Flu is something that many people take a little bit lightheartedly in a way, but it's actually something that has profound impacts on countries and on families. It's something that can be quite harmful. Is that true?
It's true. Actually, because people get used to seasonal flu epidemic, they feel that it's not very important, and because it's something they know. But actually, flu tend to kill between 250,000 to 650,000 people every year on Earth.
So it's a significant amount.
And some people are more likely to get severe disease, and if they don't get good treatment, they can die from it.
And influenza, we can protect people with a vaccine. That is correct.
Yes, so there is a vaccine every year that is produced. It's a bit a tricky disease because, as you know, it's a family of viruses. So every year we need to look at what are the viruses circulating, and we need to develop the vaccine to target those particular viruses. And this is why the composition of the vaccine changes every year.
Thank you so much. So now, as many people know, and something that a lot of people have been asking us questions on, we have a new coronavirus, and that's called COVID-19. So what are coronaviruses and what is this COVID-19?
So coronaviruses are viruses. It's also a family of viruses. We have common coronaviruses, 4 types, that are also circulating and sometimes at the same time as flu viruses. And so they also give some kind of common cold. But then we have other coronaviruses that are a bit different, because those coronaviruses are most of the time originated from animals. And so they are not exactly like human coronaviruses. They have specificities that make them a little bit more dangerous. And we had the experience in 2003 with SARS, which emerged in Asia. And then in 2012-13 with MERS, which emerged in the Middle East. And this year we do have COVID-19, again apparently has emerged also in Asia.
Okay, and it's a new virus to humans?
It's a new virus. Probably this virus was circulating in animals. And then suddenly it jumped to 1 or 2 humans and started to spread from human to human.
Thank you, Dr. Briand. So if you're joining us a little bit late, we're looking at similarities and differences between this new coronavirus, COVID-19, and flu or seasonal influenza. If you have any questions for Dr. Briand, put them in the comments section of whichever platform you're watching us on. And if you're watching us on Twitter, you can use the hashtag AskWHO. So I have a few questions for you myself, Dr. Briand. Is COVID-19 spread the same way as flu?
So COVID-19 is a very new disease. So we are still investigating all the way it can be spread between people. But from the initial observations we have seen in China, it seemed that flu and COVID-19 have same way of transmitting. And these are two respiratory viruses, and so they transmit when somebody cough or sneeze or speak. And it's transmitted by small droplets of humidity that you have in your mouth, and it goes to the other person. But these droplets cannot travel very far, so you need to be very close to people to get infected. Those droplets as well can drop on some surfaces. And if somebody comes and touch the surfaces after you have spoken or cough, then this person touches the surfaces with the hand, and then the hand is contaminated, and then if this person touches the face or the mouth or the nose with a contaminated hand, the person can get the virus.
Okay. So with influenza, we have a vaccine to protect ourselves. With COVID-19, we don't currently have a vaccine. So how can people protect themselves from COVID-19?
So actually the measure to protect yourself for both viruses are similar, because we recommend therefore to protect yourself by washing your hands very regularly, because then you cannot, if your hands are contaminated, you will not put the virus in your eyes, your mouth or your nose. We recommend also when somebody is showing respiratory symptoms, coughing, sneezing, to stay home and to rest until they recover. And if you see somebody showing symptoms, it's better to stay 1 meter away so that you are not getting the virus through droplets. Also, what is important for people who are sick, they can also protect the other by wearing a mask. But again, the best way to protect the others is also to stay home and try to not be in contact with the other, or at least more than 1 meter, so that you don't transmit the virus.
So this is something we're seeing a lot of questions about. When should I wear a mask, or when should I not wear a mask? So if I understand you correctly, you're saying if I'm sick, I should be wearing a mask to help to protect the people around me. That's the general rule?
Yeah, I think we can say this is the general rule. I think it's not necessary for everybody to wear a mask for two reasons. First reason, because we don't have enough masks for everyone, and we need to reserve those masks for the people who really need it, and the people who need it are the people who are really exposed to a very sick patient, and this is the healthcare workers, the nurses, the doctors, and all the people working closely with patients. And secondly, because sometimes when you wear a mask, first, if you wear it for many hours, you will see it's not very comfortable, and you tend to do mistakes. And instead of being more cautious, you tend to forget that what is most important is to have clean hands, because even with a mask you can still touch your eyes and still get the contamination through the eyes. So it's better to just be aware, wash your hands frequently, and you will be better protected than badly wearing a mask, basically.
Thank you so much, Dr. Briand. So we're getting so many questions from everyone here. Thank you so much for your questions and your enthusiasm on this. We'll try to get to as many as we can in the time we have. And I'm originally from Canada, so I'm going to take the first question from Canada. From Patricia Compton from Alberta is asking, is COVID-19 only a winter virus? And that way, will it disappear once the warm weather comes, which in Alberta is sometime in July? So is it a cold weather virus, COVID-19?
This is something we don't know yet. We really don't know, because we are still in winter in many places of the world where we have seen the virus. Some studies have been done on COVID-19 in laboratory. We try now to investigate what are the elements in the climate, the humidity, the heat, and so on that can influence the survival of the virus. But we need to see what will happen in summer. What happens usually with respiratory viruses in summer is that people tend to go more outside, and houses tend to be more ventilated because it's hot. And so probably this helps to reduce the transmission of respiratory viruses.
So something you mentioned there rings a bell to me is that we just have to also remember that this COVID-19 is a new virus. So we're learning more about it every day,
Yeah.
whereas influenza is something that we've been studying, we've been learning about it for many, many years.
Yeah.
So that's another similarity and difference between the two. So we have a question from, in terms of, that one we got to, how to prevent COVID-19 from getting to countries. So a question from David Mwanda, who's asking about African countries specifically. Are there any countries that are safe from COVID-19 transmission or arriving to their country? Ha.
I think,
good question, David.
Yeah, it's a good question, really. I hope that many countries will be safe from COVID-19 when we have been able to contain the virus where it is currently. And this is why we encourage countries to put in place strong measures now, so that we can stop the transmission now. But if it doesn't work, then the virus may continue to travel to other places. Currently, what we have seen is that the virus has traveled with travelers. But at the same time, it's very hard to stop all the travel on Earth, because movement is part of life. And if you stop movement, then our lives will be very different, and we may suffer a lot more from this than from the disease itself. So currently what is really difficult is to find the right balance between maintaining a normal life and protecting people. And we are looking at all the options that are available to maintain this balance right.
So something you mentioned there about containing COVID-19. We don't contain influenza, is that right? Is that another difference? And why is that?
Yeah, it's very difficult to contain influenza for two reasons. The first reason is that some people infected with influenza viruses don't show symptoms and will transmit the disease even if they don't feel sick. So they won't stay at home because they are fine. And so they will come and meet with friends and families and transmit the virus. So very hard to stop the virus in those conditions. The other situation is as well that influenza generates immunity, and so those viruses, it's a big family of viruses, they are always somehow circulating. So we would tend to let them circulate, but protect the people who are most at risk to do severe disease. And this is a strategy that is slightly different than for COVID-19.
Thank you so much, Dr. Brion. So we're getting lots of questions about travel. This is really on people's minds. So people are asking really simple questions like, should I be traveling now? So you mentioned this a little bit, but let's say people do travel. We have Lola Ramos saying that she's just returned from France to the United States, and she's worried, should she stay at home? Should she go visit people? What would your advice to people be who have been traveling, who haven't, as far as we know, come into contact with people who are sick with COVID-19?
Yeah. So currently in the world we have many different epidemics, some in terms of size and intensity. Some countries, they have just sporadic cases. So I think if you have visited those countries, your risk is extremely low. And so you shouldn't be afraid, and you should just go home and just monitor your health. And if you feel bad and sick, you stay home and you seek for medical advice. But other people will travel to countries where there is already kind of intense transmission, and there are not so many countries actually currently. So, and so if you have visited those countries, then you may be a little bit more cautious when you come back, because you may pay more attention to your fever and check it maybe once or twice a day, just to make sure that you are still safe, and do it for 14 days, for example.
Excellent. So in terms of where people can get more information, WHO's website is a good source for global information, for more specific information. If you're in other countries, their National Health Service would be a good place to start, the Ministry of Health, or for example in the US we've got CDC, in England we've got NHS. Where else can people get information on?
Yeah, I think many countries now are not only providing information through their technical agency, and this is often complex information, I would say, very detailed. But you have also hotlines in many countries where you can call and get rapid advice. And you can check on many websites. I think now there is a lot of advice, and so I think there are plenty of sources. We have also developed a page called EpiWin, where you can find specific advice if you are an employer and you want to protect your employee, or if you are a faith-based organization and you want to undertake safe gatherings, etc. So different.
Can you find that from going from the WHO site, or is it a separate link?
No, it's linked to WHO
So
site.
www.who.int, and we have information in all of our 6 languages and some other languages being developed. The more the better on that. So going back to the travel in a way, I have a question from Parima, and she's asking, in terms of COVID-19, how does the disease start, and do people get symptoms all the symptoms at the same time? So there's fever, there's cough, hard to breathe. Does everything happen at the same time, or do we know, is it different in each person or in different situations?
Actually, it depends on the people, but we have a triad that is, so the order of the symptom may depend, but people who show symptoms may have rapidly the 3 symptoms, so it's fever, and sometimes the fever comes after the cough, dry cough, and shortness of breath, which shows that your
your lungs,
your lungs are infected. So these are 3 symptoms. But then you have other symptoms like in 4% of the case people are vomiting, sometimes they have diarrhea, but these are really uncommon symptoms. So I think, and fatigue of course, but fatigue is really common to any viral infection. So.
And it's hard to give advice to individuals in many different situations, but generally people should seek medical advice if they have any of these symptoms or all of these symptoms?
Yeah, so you need to do your own risk assessment. If you have traveled to a place where there is intense transmission of the disease, of course you are more likely to get COVID-19 than flu or other respiratory viruses. So in this case, of course you need to pay attention to those symptoms, and if you have any doubt that you might have COVID-19, call your general practitioner or some hotline to get advice on how to behave and where to seek medical attention. And I think, and don't panic or stress, because most of the cases of COVID-19 are mild, more than 80%. And even now, with the large epidemic we have seen in China, 96% or more of the will recover from the disease.
Thank you so much, Doctor. So if you're joining us in the middle of our show here, this is a question and answer session with Dr. Sylvie Briand, and we're coming to you live from WHO headquarters in Geneva. You can ask your questions in the comment box, depending on which platform you're watching us on. And if you're on Twitter, it's hashtag AskWHO. We have a question from Teresa Iwa, and she's asking, what age groups are more likely to be affected by COVID-19? And I'm going to add a little bit onto that, and I'm going to say, is that also different for influenza?
Yeah, so apparently from the data we got from the first affected countries, the median age, is around the 50s. And so the most affected people is above 40 up to very old people, more than 80 years old. And the young adults or the children are less affected. Also, what we have seen up to now is that really the people will have more severe form of the disease, which will require hospitalization, also people at an older age, or people with underlying conditions such as hypertension, cardiovascular disease, cancer, or any other immunodeficiency. On the contrary, for COVID-19, we see very few children with the disease, and most of the children are very mild disease. So this is very different from flu, because in flu we see both end of the age of the life course affected. The very young kids and the elderly are often more affected by the disease, and they do very severe form of the disease as well. And in flu as well, we see that pregnant women are more at risk of severe disease, and their baby as well, while so far we have not seen this with COVID-19.
Thank you. So we have a interesting question from Mary Caldez, and I'm sure this is something that a lot of people are sensing, a lot of people are feeling. She says she's scared of COVID-19. Should we be scared? And could you give some advice to Mary to help her work through these feelings?
Yeah. I think it's normal to fear this disease because it's a new disease. And frankly, we know more than we knew 2 months ago, but there are still a lot of unknown about the disease. But as time goes by, we know more and more, and our advice are more and more accurate, I think. And so, but what is interesting is to know that it's a respiratory virus. So it's not the first one we have seen in the history of humanity, and it probably will not be the last one either. And so I think precautionary measure we use for any respiratory viruses that are transmitted from human to human are valid for this disease. And so I think if people apply those measures conscientiously and help their family and their neighbor and their friend to apply similar measures, I think many people will be protected. What is very important, I think, it's a way of greeting people, because we need to change something about how we do it. For example, shaking hands is a bit dangerous nowadays, but then you can invent new ways of greeting that can show your love or your friendship to others, but at the same time make sure that you are protecting against respiratory viruses.
Thank you, Doctor. We're getting quite a few questions about commuting and public transport systems. Here in Europe, it's the end of the working day. People are heading home on the bus. I'm sure some people are watching us online from trains and other things as they're going home from work or going to work in other parts of the world. What advice do you have for say, daily travelers who are traveling often in maybe cramped conditions and sometime in winter months?
Yeah. I think when you are in a country where there is intense transmission, health authorities have already provided guidance on that and how to reduce the density of population, I would say, in public transport or in big mass gathering events and so on. What I think there are twofold of this. We need first people who are who show respiratory symptoms, stay home. And if possible, do teleworking while you have symptoms. Maybe it's not COVID-19, it's just seasonal flu or other respiratory disease, but still, it's better to protect yourself and the others to stay home and rest while you have those symptoms. For the people who are obliged to take public transport, again, wash your hands repeatedly, because this is most likely to happen through your hands even in this type of setting. And watch your health, and if you see symptoms, again, stay home and rest.
Thank you, and thank you for everyone who had that question. We're getting quite a few people asking about vaccines. Do we know when a vaccine will be available for COVID-19, for example?
So currently there are many research groups in the world who are developing what we call candidate vaccine. So it's a product that seems to have the right efficacy, but it's just the first phase of the development of a vaccine. Because once you have a candidate vaccine, then you need to test this vaccine for its safety, making sure that the vaccine will not produce adverse effects that are not desirable. And once you have the safety, then you have to test it also to make sure that indeed it protects really against the disease, enough at least to be distributed. largely, and you need also to make sure that certain specific groups like pregnant women or young kids can also receive the vaccine. So there are a number of stages in the vaccine development and distribution that needs to be observed to make sure that once we have this product, it's really a good product that will make a difference. So in the meantime, that's why we need to observe precautionary measures that will still protect most of us in a very efficient way.
And I think we'll take the chance to repeat those precautionary measures. So how can people best protect themselves against COVID-19?
Okay, so please wash your hands repeatedly during the day. Second, if you are sick, protect the others by staying home. If you have cough or runny nose, if you have cough, do it in your elbow, also to protect the others. Runny nose, use a tissue and dispose the tissue in a closed dustbin. Rest as much as you can. And if you are sick, stay home.
Thank you so much. Let's see what else. We're getting near the end of this, unfortunately. But I've got so many questions, I don't even know where to start. Let's see. Here's a good one. Mina Brajovic, I'm trying, is it possible to be reinfected with the coronavirus? So if you've had it once, mild symptoms, and time has gone on, you've recovered, can you catch it again?
So this is a good question because many researchers are currently looking at it and trying to understand if people can be reinfected. What is true is that some people who had the disease tested negative, were discharged from hospital, and few days later, when they are tested again, they test positive. And we don't know if this is due to the test, because the test detects only dead viruses, because it's a specific test that, or if the virus is still there and alive and people have been reinfected. So this is the first question, and we are working on it. Now, the second part of your question is that if I am infected, will I develop antibodies so that I cannot do the disease again? So again, this is an important question that researchers are really looking at it right now. We are just developing the test that allow us to see how many antibodies you have in your body. So it's called serology. So when we have those tests, we will be able to look at really the people who were sick, how many antibodies they have, and does this protect for further disease. But what we have seen in China, and Chinese doctors have already mentioned it, is that if you use the plasma of convalescent people and inject it in people who are sick, it seems that it helps them to recover. So it's very likely that we develop antibodies, and those antibodies can protect also others from the disease, and probably protect ourselves from getting reinfected. But these are still very early stage of the discovery, and we need more data to affirm that we are really protected.
Thank you, Doctor. So again, if you're joining us a little bit late, we've been talking a bit about COVID-19 and influenza or flu. Mm-hmm. We're looking at their similarities and their differences. I'm wondering if you could just sum up one last time for our viewers, if people join us a little bit late, the main things that you want them to remember between COVID-19 and flu or influenza.
Okay. So the two diseases are due to viruses. These are respiratory viruses. They are transmitted by droplets. When you speak, you cough, you sneeze. They are also can be transmitted by when you touch surfaces. So that's why to protect yourself, you need to wash your hands. You need to cough in your elbow, sneeze in a tissue, and dispose safely the tissue. And if you are sick, stay at home, isolate yourself. And if you need to protect better the other, wear a mask and rest and try to take it with a lot of serenity, because again, as I said, 80% of the cases are mild, and more than 96% of people will recover from this disease, COVID-19. And for flu, If you are in the at-risk group, please get vaccinated before the flu season because the vaccine protects you. And for flu, if you are sick, we also have antiviral treatment that can treat you. So there is a lot of hope in modern medicine. So don't be too fearful and just let's fight this disease together.
I think that's a really important message. Thank you so much, Dr. Briand. Thank you to everyone who joined us from all around the world. We had so many questions. We only got to a fraction of them. We'll try to answer as many as we can in the comments boxes. Our experts will get back to you. And we're going to be doing these more and more often because we really appreciate people's questions and we appreciate this opportunity to communicate with you all around the world. The list of countries is so long. We're going to try. Okay, big breath. Panama, Nigeria, United Kingdom, Tanzania, India, Colombia, Spain, USA, Mexico, Egypt, Dubai, Turkey, South Africa, Sweden, Sudan, Iraq, Ecuador, Iraq again, Bhutan, Yemen, Lebanon, Italy, Lithuania, United Arab Emirates, Ukraine, Canada, El Salvador, France, Portugal, China, Zambia, Slovakia, Denmark, Ghana, Brazil, Saudi Arabia, Algeria, Mauritius, Cameroon, Switzerland, Serbia, Jamaica, Bahrain, Pakistan, Germany, Sierra Leone, Qatar, Argentina, Puerto Rico, Senegal, Uganda, Jordan, Tunisia, Peru, Barbados, Indonesia, Austria, Northern Macedonia, Estonia, and I have to read more, there's so many, Greece and Rwanda. That's 62 countries. Soon we're going to have to be listing the countries that haven't joined us. It might be quicker. If you want to get more information on COVID-19 or influenza, it's www.who.int. Thank you, Dr. Briand, for joining us. Thank you, everyone all around the world for joining us. We look forward to talking to you again soon. Have a good day, evening, morning, and we'll be in touch soon. Goodbye.
Yeah, goodbye. Thank you.